For more on this, I'm joined by infectious disease specialist Dr. Craig Jenne, and he joins me from Calgary. Thank you so much for joining us this morning, Dr. Jenne.
Good morning.
Well, after a long stretch of no new cases, PEI is now reporting 3 new cases. How concerning is this, especially with the Atlantic bubble just opening?
I think, unfortunately, this highlights the threat of reducing screening and trying to go about our lives as normal. The Atlantic bubble would have afforded, or may still afford, free travel within a number of provinces without the need to self-isolate. However, this clearly demonstrates that if there are still viral cases within that region, my understanding is at least one of these patients perhaps picked up the virus in Nova Scotia. There is a need to continue screening and to have isolation procedures in place.
All right, so what are the most important things for people to remember if they decide to travel within the Atlantic bubble?
So it's important to understand what the viral situation is like at your destination. So are you going into an area that has higher viral numbers? And we see that, unfortunately, Nova Scotia has had higher viral numbers than PEI in this case, but that's largely due to the fact that Prince Edward Island has had no cases for over 2 months now. And you have to then balance your risk. So unfortunately, it sounds like one of these 3 people in Prince Edward Island works in a long-term care facility, and that is sort of the worst situation. We do not want people bringing a viral case into a long-term care facility and potentially exposing at-risk patients. It appears as though this was caught very early. The person in question was wearing full personal protective equipment, and the risk may be low to the residents of that facility, but it highlights the need to continue to screen and to continue to self-isolate where necessary.
Well, as other provinces look to reopen their borders, do you think the Atlantic bubble is a great example of how it should be done?
I think it has a lot of strengths. I think what has to really be considered is that this still probably cannot be a free-for-all, that once the bubble's established, we still have to maintain high levels of screening. If there is free travel within a zone and we are not looking for cases, by the time you notice somebody with symptoms, that virus may have spread quite extensively. So free travel and lack of self-isolation is a great thing, but it can only occur if we have robust testing and further contact tracing still in place in those zones.
Speaking of borders, the Canada-US border, of course, is still closed. They still have a major issue down south in the U.S. What do you think the strategy should be when we do decide to reopen our borders to the U.S.?
I think once we reopen, we are going to have to go with a full mandated 14-day quarantine for anybody entering from the United States. I unfortunately think we're looking at many months before their viral caseload gets anywhere close to where Canada is at the moment, currently being 10 to 100 times higher than even our worst regions currently. Suggests that people coming from south of the border may represent a significant risk to reintroducing the virus to the Canadian community. So once we do get the border open, we are probably going to need to go through a significant period of time with a mandated quarantine.
Well, thank you so much for your insight. Once again, from Calgary, that is infectious disease specialist Dr. Craig Jenne. Thanks again for your time.
Take care.